I'm ready to go.
Hey everyone, this is the Manips and Sips podcast, and featuring me, I'm Dr. Jeremy Boyd, and my partner in crime over there, Dr. Brandon Cruz. Today, we're going to be talking about managing the runner. I'm sure we all have some runners who are a little bit finicky and are coming back for a couple things here and there. So it's a good thing to talk about because we haven't brought it up on the show quite so much. But before we get into it, Brandon, how's it going?
Going well, Jared. How are things on your end? I know you've been kind of out and about. This actually, just for our audience, probably take a little break, right? Because you're going to Italy for a couple weeks, right?
Yeah, as long as it goes down with everything, travel is seems like it's becoming a little bit more difficult.
Yeah.
We recently were supposed to go to a wedding in Bermuda that we couldn't go to because of some COVID stuff. But hopefully all goes down. Should be a blast. Haven't been to Italy yet, so fingers crossed. Yeah, I'll be out there probably for 2 weeks. And then I think it'll last hurrah before we work on some other projects at home.
Yeah. Fall's gonna be busy for both of us. Definitely looking forward to today's podcast. Gonna be talking about managing the runner, as Jeremy said there. So probably less article based on this one and more, I guess, anecdotal and just kind of our experiences and sharing, our philosophies and treating these types of people. But before we do that, let's go into our usual drinks of choice today. So what do you got, Jay?
All right, I got Chill Wit, as in it's a wit briar, with my homies by Neck of the Woods Brewing, which is local to me in Pittman, New Jersey. Really cool brewery. Kind of a woodsy camping sort of style feel to it. Love the guys over there. Devin is one of the owners of brewers over there, and we get to see his daughter for a surgery. So he brought over some awesome beers. It's actually where I also play my men's league soccer, which we're on a 2-game win streak after losing the first 4. So we're finally getting it down. But let me crack this puppy open. Thanks, Devin.
You guys 2-4 now?
We're 2-4. We had to figure it out. First couple of games, we didn't. Our goalie wasn't in. I tried to play offense, which I probably shouldn't have. So I moved back to defense, and we're finally kind of getting in sync with things. So the team that mopped the floor with us the first game, 13-4, I think it was the biggest deficit in the league thus far. We beat them last night 7-6.
There it is.
5. So yeah, it was nice. So if we win the next 2 games, we have a doubleheader next week. We're probably in the playoffs. But let me cheers. This is from Gale Brewing Company. I think I went to them in the Finger Lakes. They weren't bad, small, but not bad. Oh, that's good. Classic wit. At that. I've had a couple of these over the summer. Get kind of that oatsy kind of taste to it, kind of lighter of the beers and wheat. Has some coriander, orange, lime peel, peppercorns, lemongrass. So a lot of fun stuff in here. Nice spice to it. I'm gonna give it a 7.9. That's the first number that came to my mind. But nice job by the guys at Neck of the Woods. But Brandon, what about you?
Good stuff. I went back to my Herradura that Franklin got me. It was just really smooth. I have another tequila, brand new tequila that someone got me. Manny, another former intern, did a great job. Just finished up. He's now graduated and just waiting on taking his boards. So I was going to grab that, and I will, Manny, but this bottle was speaking to me. It was so smooth last time. I had to give it another go. So that's where I'm going with this one again. So thanks, Frank. Actually, I got to reach out to Frank to see. No, he didn't take the boards. He's just finishing up his internship too. He has to at another location. But I will make a shout out to my man, 8 Cakes, Alan Trinidad, former student of mine, now new hire. Just finished his rotations and just got news on Tuesday that he passed his board. So big shout out to my man there.
So 8 Cakes
on that. So he's going to be starting the end of end of the month, really. With us, he's just going to go on some vacations, well-deserved time off, and some downtime before he jumps into it. So, congrats, A Cakes,
Congrats.
and
Cheers, dude.
I'll see you on the other side, my man. All right, with that, let me get my wet the palate before we start.
There we go.
Here we go. All right, managing the runner. I'm presuming we're talking the marathoner, the ultra marathoner, the distance runner, not the sprinter right now, which maybe we can have a different episode on that. But
Yeah.
I think when we hear runner, we're thinking those distance runner, their endurance runner, maybe the triathlete or as well. So just I guess just to let everybody know what frame of mind we're coming from and what this is going to be on. So, Jared, how many or how often are you seeing runners still? I know you've switched more to, the high school, college athlete. Are you seeing cross country runners? Are you still getting people that do marathons? What are you seeing on your side?
Yeah, so it definitely has changed. But I still get runners. We still have a good reputation amongst the runners. Currently, like right now, I have 2 fairly recreational runners, but they're at like the 60 to 80 miles per week. So they do it very regularly. One of them, I think he reported he once had the 4th fastest mile time in the country or something like that. It was like 4 minutes, 10 or 4 seconds. So that's one of them, or 2 of them, husband, wife. I can see why they're together. And they're 2 very elite level gymnasts. So it's a nice, fun little party at the end of the day for me. And we have a triathlete and a couple of just recreational runners who'll do like Spartan runs and half marathons and stuff. So just a good overall mix. I only have the couple right now, but what about you, Brandon? What are you seeing?
Yeah, I mainly see, especially in my neck of the woods, very running is probably one of the biggest. What you got there? What the bottom say?
Oh, neck of the woods. I was
There you go.
Paid for, not paid for advertisement.
Not paid for sponsorship there.
We gotta get sponsored one of these days.
Yeah, we gotta work on that. Like Joe Rogan, he's always repping something. So is right or weed or something. I don't know. He's always doing something. He does it right.
We need alcohol companies.
What's up?
That's the only sponsorships will allow is alcohol companies.
Yes, yeah, that's all we can get. I don't know if that'll lead to something good at the end of the day. We might turn some alcoholics here, but what was it? Oh yeah, running, recreational running, distance running is big in my area. From 5K, 10Ks, these bike tours. I know it's biking, triathlons, marathons. I have runners by me that are literally. I have one right now that she's doing like 3 marathons in 3 months or something like that. Actually 4, because one's going to be recorded or you submit a time or something now with COVID and everything. So I do see a lot. We're involved, and definitely more so was involved with a local running group.
Nice.
Before COVID has, definitely kind of dampened that relationship, as obviously a lot of people were isolating and kind of just closing down, and they weren't doing their group runs and things like that. But yeah, we have a nice little niche seeing runners. And I would say the big thing I've noticed, and I guess this will segue into our topics, is I'd say the 2 big things are being able to connect and communicate with runners and why they need to probably do less running and more of some of the other stuff. Being able to get that message across, because all they want to do is run. I find them to be a unique breed. I don't mean that in a negative way. There's different, and their mind works different, and they're in a sport that relies. You don't need to be social for. A lot of times it's runs by yourself or maybe with somebody else, but a lot of talking is not going on. And most sports, running is punishment, and we don't like to do it. We just want to play the sport and not run in condition. So I think right there that becomes just a different breed and mindset in being able to enjoy long distance running as a hobby or a sport. The other thing I think is just movement deficiencies. They do one thing: they run and they're in a sagittal plane. 90% of the time they sit down at work, probably running is their stress outlet. They can go out for miles and just kind of clear their head out. So they're only moving in one plane. So I notice a lot of these guys and gals have trouble moving in different planes, and that's where my treatment tends to go, really trying to communicate to them and then develop different movement patterns or different variability. What about you, Jay? What have you noticed with runners?
Yeah, I mean, to piggyback off of what you were saying, I try and do some presentations at local clubs and running stores and that sort of stuff, and I'll bring up the story of when I made a presentation on performance with running. So trying to increase, your speed, your time, your duration, how many miles you could per week. So I was bringing up all the research and literature for that, and most of it was, not running or working on interval running or strength training and all that sort of stuff. And by the time I paid attention and looked at the crowd there, I was getting a lot of daggers. And at the end of the thing was, how can we prevent from, I have Achilles this and patellofemoral runner's knee, and that's how I prevent that. I was just like, all this stuff here that I just presented on, and it was probably asked 3 different ways, and my answer was still like, yeah, this stuff. And each time you can just see the disappointment. It wasn't the answer of like, yeah, should I switch up my shoes or switch up my runs? I'm like, all right, clearly I'm not presenting this well enough. And I was a little bit younger, so I needed to read the audience a little bit better. But yeah, I thought I was going to get stabbed in the parking lot later. But yeah, the main thing is, based off of, the same stuff that you're saying is, that connection piece is big. Understand their why behind it. I have, we have an ultra marathon runner who owns a gym and this sort of stuff. So it's kind of like his business to run to the degree that he runs, but he understands it comes at sometimes a cost to his body. And then there's some people that it's like legitimately their sanity. And they'll do whatever it takes just to kind of go about doing it. So kind of getting on their level, understanding it, versus, certain situations, maybe when I was younger, I'd be like, listen, you're just running yourself into the ground and not understanding the why that they needed to do that, and then working on, potentially giving some other options. I think overall, like motor control, a lot of the individuals that kind of pick up running or these people who've never actually really done anything. That's the beauty about running, is it's naturally, programmed into our brain there to run. It's natural instinct to a degree. Now we all do it well, but it's programmed into us. It's cheap, and it doesn't really require much besides sneakers. But I'm starting to find out, a lot of people like, I do it because it doesn't cost anything, and you start adding up all the sneakers and the events and the races and all that sort of stuff. They're paying more than gym memberships per month, but nonetheless. So those
and don't forget the awesome Lululemon pants that they have to buy to run in too.
You have to. It shaves off at least 10 seconds.
Yeah. I gotta tell you, finish what you're saying.
Yeah. But yeah, that's the main thing, is even things in the sagittal plane that you were talking about, they're having trouble with. And I don't want to say like they're, we mentioned on the show motor morons or anything like that, but they, they go from maybe not having any experience in sports or anything like that and going into running, or they're ramping up like that. It's just the big thing is like, especially a lot of runners, has its benefits. You can lose a ton of weight from it, and they'll just keep running, increasing their load. And eventually they hit that brick wall, and then pain, problems, issues happen. And they just never had the right foundation or didn't build up the capacity quite right. So those are a lot of the big things that, I said, just from just overall big picture stuff. I don't kind of go as crazy into like, running forms as much as I used to, but kind of just more bonding with the patient, kind of seeing the why behind things, and then looking at the basics there. But Brandon, what were you about to say in regards to that Lululemon?
Yeah, so, and kind of piggybacking off of your story where you gave these awesome presentations, and your community, or you think you're communicating to, okay guys, you want to do this, we need to do X, Y, and Z, right? Or whatever, however you broke it down. And then they're like, okay, yeah, but what else can we do? Like they want us that like silver bullet or that magic thing,
Yep.
without putting, and they all know that they have to put in the work. They just don't want to, just want that quick fix.
They are too.
So speaking of cost, right? I have a client, she's a regular now. She comes back and forth. And she has bought and she doesn't have a, terribly high paying job, she's a blue collar worker, has bought a pair of Normatec boots.
$1,000
to
at least.
Actually, she has the knockoff ones, the Air Relax. I shouldn't say knockoff, but the lesser brand, right? Not the name brand, right?
Yeah,
so what are those? Anywhere from $500 to $1,000, like you said.
Yeah, like 500, 800 bucks.
So she has bought that, doesn't use them. I think she used them once or twice, she said. Has bought a Peloton because she thought that'd be a nice alternative to running, to give her body a break and introduce different movement patterns, though it's still on the sagittal plane.
Cycling.
Not connecting that dot there. Barely uses that. I would like to buy it off her in a couple years. Just put it in office.
Hopefully she doesn't listen.
Unless I tell her about this, she's probably not listening.
Okay.
She hears enough of my wretched voice during our treatment sessions of what we should do and stuff. And I'll tell you about that in a second. What else has she bought? The Hypervolt.
Okay. So
doesn't really use it.
350.
Yeah. Always has the best clothes. I'm actually a little jealous. Like they're nice. Like Lulu or Athleta or Aloe, really high-end pants. Cool designs too. And then sneakers, like you said, goes to Fleet Feet, and running shoes, good ones are usually up over $100, and obviously you have to replace them, or they say to replace them every 300 to 600 miles, right? Somewhere in that window, or every 3 to 6 months, somewhere in that window. I don't know if I agree with that. I mean, personally, granted, I'm not a long distance runner. I'll run my 3 miles at a clip. On a good day, maybe 4, but I'm usually between like 2 and 3. I'll run just to kind of keep my decent cardio. But I run in shoes that are like 10 years old. I don't know. I'm fine. I don't have plantar fasciitis or hip pain from running and things like that, or back pain. I'm fine. So I don't know how often you really need to get a new pair of shoes. But again, I'm not running 10 miles at a clip and things like that. So that might change. But there may be an argument. You ever read Bored to Run? Like, and there are people in other countries and stuff like that, and they're running barefoot.
But yeah.
I forget the guy's name right now. There was that marathoner, who ran basically externally rotated and pronated, and he was like a world champion, like fastest mile time or marathon time ever.
Yeah, it's like he's got the worst pronated feet,
and like crappiest feet, crappiest shoes. People from other countries that are just underprivileged, and they're running barefoot for miles. So I mean, how much of it is you need this, or how much is this is the running community or researchers that are marketing and just want to sell you a new pair of shoes every 6 months? Who probably came out with this? Nike. They want to sell you more shoes. So I'm more deviating off of this topic now to different things, but that's probably the least of your worries, communicating to your patient to not maybe buy shoes as often. That's not the low-hanging fruit, though they think it is. And maybe the short-term fix. There you go, my man.
Oh,
yeah, look at that. That is some extreme valgus going on at that ankle, or pronation. And I'm assuming doesn't have that much pain, or very little pain. At least not enough pain to stop him from being, the tops in the world at running.
Exactly.
So, how much of it is actual mechanics and a perfect stride for some people. But anyway, back to, we'll get to that in a second. Back to this lady who buys every toy under the sun, instead of addressing what we need to address, which is her movement deficiencies, being able to perform a deadlift or a hinging pattern, being able to stand on one leg with one knee up in the air, like in a single leg stance for, more than 0.2 seconds before falling over, being able to do a chop or a lift in a half kneeling position, being able to squat 20 pounds. Right, and that leads to her becoming more and more rigid, more and more stiff, because now her body can't operate under the load and duration and intensity she needs to and wants to as a runner. So the body is only going to allow you to move in motions, range of motions or limits that it feels safe in. Other than that, it's going to stiffen up. And she's only 30 something years old, becoming very, very stiff. That of some like 60, 70-year-old women I've treated. And it's like, we need to move. So I saw her, I think, pre-pandemic, and then she had a race and she ran a record time, personal best for her. And she had come back, after now. So this is now present day. And she's like, there might be something onto these lunges in the strength training, because last time I was here, a year and a half ago, I ran a personal best after I finished with you. All right. And still she does it because she knows, but she fights me on every little thing. So again, it's that communication piece, it's that buy-in piece.
Yeah.
I've now gotten to the point where, we do some manual, I do my corrective exercise with her, and then my loading exercise, and I pick two main lifts and like some accessory stuff to kind of work on. And then like mentally she's just like, I'm done, I can't do anymore. And it's like, cool, we'll leave it for today. Meanwhile, there's 1,000 things I would love to work on her in the session, but I know for her, she can only tolerate probably more mentally or emotionally, doing a couple things rather than 50 things. So yeah, what are you gonna say?
Mind blowing, because they can run continuously for hours on end, hour and a half, with
pain,
with pain, or you're just doing it, but all of a sudden you introduce some load and that sort of stuff, and they're like, one, they're wiped out, but two, it's just like, yeah, I'm good. I'm like, your run time is usually 30, 40 more minutes than this. Why, why are you so afraid of this sort of stuff? I think what you said, like buying, get the buy-in, I say, especially for these, and hate to knock runners, but there's sometimes your frequent flyers with sort of things that I try and do is buy your time, in a sense where it's like, I may give them what they want. What I mentioned before is like, for whatever reason, ART's very big in the runner realm. It's the quick fix, and I'm part of like a runners group and on Facebook, and a couple of them at this point. And everybody throws in like, I have this, what do I do? And then, like, especially with the ARTs and that sort of stuff, it's just like, I have ART every time I have it, I just go and get it. It feels great, gets me through the race or something like that. So I'm like, it's always like every time I have it, I go get it. My thought process is like, why actually fix it,
don't get
treat it, and you'll be fine. But you'll spend $60, $70 for an ART session. So especially with the runners and that sort of stuff, I'll try and like essentially buy my time, where early on I may do some more manual than I would typically do, make them feel good, try not to scare them with too much weights, even though I'm like dying to give them some. Like one of the runners I was referencing, the couple there, I had him for a couple things in the past and that sort of stuff. And anytime bands, okay, once they started throwing some weights and that sort of stuff, it was no go. And I'm like, try and encourage them. And I always try and spit the performance stuff, especially if they're the performance stuff. Recreational runners, a little tougher, but if it's like, I've hit a wall, I'm like, this will get you past the wall. And that's when they may be able to buy in a little bit more, but I'll work on a little bit more. And it's usually like 2-3 weighted exercises, and when they'll say, they're like, God, I'm sweating, or I'm dying, I'm like, you run for an hour and a half and I gave you 2 exercises of 3 to 4 sets, and all of a sudden you're wiped out. So hopefully they sip the Kool-Aid and that sort of stuff. But unfortunately, especially that with that kind of quick fix, let me get some ART, they anticipate, well, if I do a couple weight training sessions, I'm gonna get that PR the next time I run. Like, no, it's gonna take a couple weeks at least for it to really adapt and change some tissues. But they're definitely a unique breed. But it's always fun. I think it's always great, especially like in your case with our triathlete guy. He's gained PRs first time in years, where you have these people hit these walls, and all of a sudden they're getting PRs, and significant ones. It's one thing if you shave off a second, maybe the wind helped you that day, or you dropped a big one in the bathroom beforehand, you got a little bit lighter or something like that. But when you're shaving off seconds, huh?
So that's what it is.
Yeah, come on. I used to do the Broad Street every
Lighter, yeah.
yeah, 10 miler and that sort of stuff. And if I was going light, it was a very easy race. But yeah, so especially when you're making those big changes, a couple 30 seconds, 20 seconds. That triathlon person like that, him and his wife do them every year. And my goal is to make sure he beats his wife. So apparently his wife beats him on the swim. And
Okay.
then it's the run that he has any, like the bike and the run, he has any chance to catch up. But apparently it's blowing him out. And that's so I'm like, all right, tell her time's up. So I think that's the most fun part of things with them. But Brandon, what we kind of talked about some trends that we see in our runners, just from a persona wise and that sort of stuff.
Mm-hmm.
Anything specific, and maybe we can kind of go through some subjective, objective, maybe dash a little treatment, but anything in the subjective thing, some cues or anything like that you hear or listen to, that makes you want to look at something, address something, or anything like that beyond what we've already kind of discussed.
Can you give me an example? I'm trying to. What do you mean by?
Let's say like when we're running, and like let's say breaking down some things of, I pray in early in the run, or at the end or after my run, or anything that you hear that's a common or particular to runners, in that subjective piece. And figure we can kind of go into some objective or some big things that you like to look at with your runners.
Yeah, I think for runners, I think that one's a little harder, pure subjective, because I'm going to relate it to objective findings. And if you just watch runners run, and granted, this is bias and pattern recognition right here in my description, which I know we're always talking about test retest and try to be objectifiable as possible. Most runners, though, I'm going to generalize here. Most runners are knee or quad dominant, and you'll see a lot of knee pain. Yep. Which will lead to a lot of hip pain because of the way they have to swing their leg, or they're lacking actual knee drive, or they actually can't drive their knee up high enough. So they get a lot of hip pain with that, or like IT band tightness. And it really comes down to lacking hip strength, glute med, glute max, hamstring strength, coordination, like what we were talking about, a little bit of motor neurons. I mean, you get a runner to do an RDL with 35 pounds and they're shaking like a stripper.
Like a stripper.
low back, especially runners as they fatigue. And you'll hear this a lot. Most runners, they're okay in the beginning. They're fresh, they're fine. Usually that 4, 5, 6, 7 mile, somewhere in that range, depending on, what they're doing, they're going to get more, whatever their symptoms are amplified at that time. I find runners actually run too erect. Long distance runners run too erect. They need to have a little bit more of a forward lean. I don't know if we should even get into pose running and things like that, and cadence, which I think is oftentimes probably too overblown. And a lot of times the quick fix and the answer is, just increase your cadence. Because what that does actually shortens your stride. But is that actually fixing what's happening? Do you need to shorten your stride because you don't have the flexibility or endurance to have and generate the same force throughout each stride after 10,000 steps or strides? Understanding what muscles, this is now gait and running gait that are into effect. And I don't know if people have run track, but understanding what a hill workout is like and what muscles you need for a hill workout. Again, that actually works on you leaning forward and driving your knees up. But you're getting your power from triple extension of hip, knee, and plantar flexion. So you need to work on that posterior chain. Trying to find out, if they had a run that was more uneven or hilly, what type of pain and where did they feel it and how long, versus something that was flat, versus something maybe they're trying to do a sprint workout, so when you're treating them, being able to explain, and you were talking about trying to make those connections for patients so they have that PR. Hey, how that last kick or that last leg when you're trying to amp it up and you don't have juice, this exercise is going to help with it. Or, when you're running up a hill and you just can't get your feet moving enough, or your time really just takes a dump, working on, these posterior chain exercises was going to help kind of give you that extra juice or extra power in your run. Um, you know, Strengthening your legs and improve your running economy, which is then going to allow you to run further more efficiently. Making these connections of what exercise you're doing is helping. Um, so it kind of, I would say, you kind of have to see them move and get a good understanding of running, what's going on to be able to treat them. I'd say when in doubt, a lot of these patellofemoral pain syndromes or IT band syndromes or FAI aren't really or Achilles tendinopathy and things like that aren't actually, you've said it before, the site isn't the site of pain isn't where the injury is. Right. And I find a lot of these runners need to one, learn to move in different planes, two, probably looking at their low back, and three, looking at their hips, both mobility wise and strength wise, and not just the glutes, hitting the hamstrings. Very crucial in runners. And I know we're not talking about sprinters, but if you look at sprinters, one of the most common injuries of sprinters is, a strain of their biceps, biceps femoris, right? So clearly something is not happening on that posterior side on the long distance runners, and then on the sprinters, that glute and hamstring, there's not a correct balance or sequence that's happening there with sprinters. So I don't know if I answered your question there, but that's how I kind of go about viewing it. So that gives me insight to when they tell me something subjectively, I know where to look on their body objectively. So it's kind of a roundabout way of getting to it. But
Yeah, kind of a dynamic flow and wheel of things. No, I agree with what you're saying with those sort of things. And piggyback off what you said, some things about like changing up cadence and even changing up like the postures of things, and telling people change up where their foot landing is and that sort of stuff. I used to kind of try and play around with that a lot earlier on and find little value into that. If anything, I probably screwed up more people. Runners, especially the injured runners, tend to be more in their heads than just about any athlete. So trying to teach them, hey, I need you to increase the pace a little bit, or extend the hips a little bit more, or try and land on XYZ part of your foot. That tends to screw them up even more at times. Can potentially even lead to some hypervigilance and over a thought process of a certain area. So I try and again look and see what other things can be done. What can we strengthen? What can we improve the motor control or movement pattern, and see how far that takes us versus trying to go and do it by changing their form and up and those sort of things. I think things that you said, like having later on pain and those sort of things, are spot on. A lot of runners, they'll have that pain even early on, and then it fades away. It's like it hurts as soon as they get up, and then as soon as they get to mile 2 and that sort of stuff, it dissipates as well. I start to think that's probably a more muscular base. They're trying to finally get some things warmed up, and now you've got some co-contraction and activation of tissues, and now they're fine, and then they die afterwards. Those are the ones that we may need to highlight more of those, like, hey, I need you to do some active warm-ups beforehand, or a little bit more of maybe, especially of those glutes and hamstrings. Those later longer distance runners, they start to say that the pain starts to come out towards the end of the run or right afterwards and that sort of stuff. And they kind of sometimes report some things like their leg feels sluggish, or it's going through quicksand. There's almost a disconnect between the legs. Those I start to think of things maybe further from the site, maybe some neural stuff. just because that disconnect, it's not going to be so much your muscles just don't certainly turn off in the middle of things, especially when you're utilizing them. There's a fatigue factor, but it should be fatigue factor in both. So, and then always kind of what I try and listen to, or what I try and probe, because most people won't make that link, is, as we mentioned before countless of times on the show, is asking about other areas, as Brandon alluded to. Pain is a liar, or again, something's potentially coming from another area. So stiffnesses, tightnesses of certain areas, I don't let that slide anymore. I used to kind of blow it off in the runners. I'm like, you're running like 80 miles a week, everything's going to be tight. But especially when they're reporting just one area, like, oh, just the left side of my back, or just the left hip, or something like that, and that correlates with things, the ankle, whatever it may be, that's probably some important telltale sign. You just have to go probing, because again, a lot of them are just so focused on their knee pain that happens at mile 5. It has to be my knee versus something else that could be going on. But so I guess kind of tie into, unless you have something to piggyback off of, we talked about some subjective and those sort of things. Any like money things that you always like to look at in particular in your runners, besides obviously running, probably? You mentioned RDL. I don't know if that's something you integrate all the time. Is there anything like, these are the money ones? I like to integrate those.
Yeah, I mean, well, manual therapy wise, I'm usually looking at the hips, low back, at
Joint play.
Yeah, joint play, accessory motion, even range of motion. That TL junctions tends to be huge at runners, especially, like I said, a lot of them tend to be too upright. They're extending too much. Obviously, foot and ankle. I like, anytime I work on anything foot and ankle related, I am clearing out the whole foot, the talocrural joint, the rear foot, the midfoot, the forefoot, big toe extension, especially. Like, I clean it all up. It really doesn't take too long to do so. You're there anyway. Just spend a couple extra minutes just cleaning up those areas, because especially if somebody doesn't have that true dynamic stability, their body inherently is just going to stiffen up naturally to try and give them that stability. So I'm looking at that stuff. In terms of exercise, yeah, move well, move often, right? We've kind of talked about that. So I want them, they do enough running. I don't need to work on running with them. I need to either offload some areas and structures, or just get them to get used to moving in different ways, so they have some variability when they are moving. So yeah, I'm looking at, can I normalize your squat? All right, can we get you to squat good? Even if it's just a parallel, like I don't need you to squat ass to grass. I just need you, can we get you to parallel pretty neutral without you just like falling over? Can we get you to do a hinge? That's what I'm looking at. Some type of core exercise, a chop, knee tucks, or a pike on the physio ball, or maybe some type of farmer's carry. And then I love my lunges statically, offloaded, unilaterally, or have him hold a 15-pound weight on one arm hanging down, with one arm up here with some weight, getting some core, and a step up with a knee drive with or without weight. So there's some dynamic movements there, as well as something that replicates running, and it gets them used to driving that knee up, balancing, letting their hips or pelvis stabilize there, and having their core work and glute engaged, get terminal knee extension, which a lot of them can't or don't have that awareness. So those are usually my kind of go-to exercises. Of course, I'm going to modify them as needed with them, but a lot of runners I've noticed, they just can't do an RDL. They have no hamstring strength. They have no glute strength, or maybe motor control awareness of how that is. They literally shake and tremble after that. I've had two, actually, well, one's in conversation. The other one I had, she was a swimmer in high school, college, then has done CrossFit for years, and recently has done triathlons. She was never injured. I saw her once because she tweaked like her mid back / rib, manipulated her, gave her some self mobs on a foam roll and stuff, and then she was fine and did great. I think she did so well because she was so and she's a lean person to begin with. She's just strong. Like she does CrossFit, she weight trains. And she continued to weight train while she was training cycling, swimming, and running for her triathlon. I'm talking to a gentleman. He's in Florida. He's a PT, owns his own CrossFit gym, but his new hobby now is triathlon. So he was telling me how he had a picture. Someone got him and a bunch of other guys coming out of the water running, and he's like, "Why is this dude so jacked?" And he's like, "Oh, that's me." Like he was like the biggest guy there, and he doesn't really have any injuries, and he does well with it because he does cross training. He integrates that. So if we can get that message around to other runners, hey, you don't need to run 8 days a week. I'm exaggerating. Most of them will run 5 days with 2 off days in there, and then they'll have a long run and a shorter run, and then some tempo runs. Like you probably don't need all that. You probably need to integrate 2 days of strength training. Instead of running 3 miles for a short run, how about you go strength train?
Yep.
What's that really going to do for you, right? Or maybe have a 3-mile run instead of doing a 6-mile run. You do a 3-mile run and some working out, like some weight training. So being able to integrate that. And what about you, Jay? What do you like to look for? I don't know if when you did your sports fellowship, did they have any clinical pearls on runners? I think they had a running section. I'm not sure if you had a chance to take that running specific course. I know you wanted to, but yeah, if you could.
I did. I didn't get a chance to take it. I think we had a course. I'll probably will take it. They have a running rehab specialist kind of course. I did as part of the fellowship. There's electives. I decided to take dry needling, even though I can't do it in New Jersey. But just because I wanted, it's great for anatomy, and again, I wanted to get that skill hopefully for one day when it comes back. But yeah, they definitely emphasized it, talked about it. It was getting kind of like a piece of things, and then if you wanted to go more into it, they have the full course. Yeah, things I like to look for. Something even before the fellowship. I like the lateral step down test. I think that's a quick and dirty way to just get an objective measurement. Obviously, it's kind of subjective to the person looking at it, but most of them, I mean, the lateral step down is just the similar motion to a run, same amount of knee flexion at times. And it's just a control thing. And they almost always, have poor dynamics, knee valgus, or they'll shift their trunk over, lack the adequate dorsiflexion. So it gives me a lot all at one picture. And then it becomes my gauge, and then it becomes a patient gauge as well. And then it becomes, on top of that, becomes an exercise. I'm like, this is, or most runners, I would say 90% plus at least, get up, they run in the morning for the most part, get up, run, and go. Half of them wear their running stuff to bed, put on their shoes and go. Other half leave it all nicely packed up and ready to go. So to ask them to do something beforehand, highly unlikely. But something like the lateral step down, find a curb and do this. Hit some glute med. We're working on control, prepping the motion and preparation to kind of avoid, some of those excessive knee valgusers. And you're working some ankle range of motion. So I like it from an objective standpoint. I'll look at their squat, just as you mentioned before, just can they do a normal squat? And a lot of them can't, which is pretty surprising. It's like, I saw you get up out of the chair, and then I saw you come do a squat, and they're completely different patterns and that sort of stuff. I'll do some things where try and have them like do the running motion in a slow motion kind of way. You can kind of see a quality control, but a lot of it's getting them on the table, seeing some things, everything that you mentioned manually. I think some big things are hip extension. A lot of people are the pusher style runners, so they're erect, as you mentioned before, which I see a ton of, and they're just going from hip flexion to neutral, hip flexion, neutral, hip flexion, neutral. And that leads to some knee pain, ankles not getting to full dorsiflexion because they don't get to that full end stance phase, and their hips and stuff. So I like to make sure they have adequate hip extension. So many of them can't even get past neutral hip extension, so they can't get their knee past their trunk in a sense. So that's what I like to look for, especially those longer ones that we talked about. We're paying longer in the moment. looking at neural dynamics. We talked about that in an episode, especially with longer, injuries or high intense interval stuff. So you got to think you're ramping up that nervous system, doing something in the sympathetic nervous system for an hour, hour and a half, 2 hours, 3 hours. You're already winding it up and that sort of stuff. Do they have good mobility of that? So those are things I like to look at. So I'll look at sciatic nerve. If it's something more distal, look at, tibial nerve, sural nerve. I like to now spend a lot of time looking at femoral nerve, those IT bands that just don't get better, a lot of femoral cutaneous. So those are a lot of things I like to look at, and then, assessing the spine and such. So, I like the RDLs. I think may have gotten that from you from the past and that sort of stuff versus just purely lateral step down. And, half of them, they can't keep their hips level and they're shaking all around. So, I also like to look at because almost all of them will do the runner stretch, which is, I believe, the calf stretch against the wall. But then when you actually look at their, weight bearing dorsiflexion, none of them can get, what standards about fist, 5 inches or whatever it may be. And none of them can get it. Like, well, I do this stretch and that sort of stuff. And, they're trying to passively stretch the tissue, the muscle, the gastroc complex, but doing nothing for the joint itself. So, you're hitting that roadblock at that joint, you're just not going to get very far. So again, that kind of ties into my treatment as well. So I'll see that, hop them on the table, mobilize them, see how they do afterwards. To appease the runners, a lot of the times I'll do the slow motion videos on my cameras and I'm like looking in slow motion so they know that I'm looking at it. And a lot of the times I'm like, all right, yeah, it looks okay. Now I'm going to try and change too much, but based off what I saw on the table and how you run, if we can work on these strengths of XYZ, it's going to kind of self-correct itself versus you losing your mind trying to tweak things on your own. So yeah, it's kind of how I like to go about things, and obviously some offshoots and branches from all that. But in a nutshell, that's kind of what I take a look at for sure.
Yeah, I just want to, I guess, add on to what you were saying. You made some great points. Like you said, chronically tight IT band, you're looking at lateral femoral cutaneous nerve. Runners always complain about tight hamstrings. All right. Instead of stretching them, look at that sciatic nerve or hamstring strength or glute strength. Chronically tight calves, and they stretch enough that they think that's the ticket. Like Jeremy said, looking at ankle dorsiflexion, mobility. I'm also looking at sciatic, tibial, sural nerves, plantar heel pain or bottom foot pain. Same thing, sural nerve. Peroneal tendonitis diagnosis they might get. Look at the ankle dorsiflexion or look at peroneal nerves. These are things that when you begin to think outside the box and stop looking at everything as muscle, like we're taught, or fascia, you find that the low-hanging fruit tends to be more neurodynamics, joint-based, and then movement control, and whatever falls under that umbrella that you want to put under movement control. So I think it's kind of it for what I have to say. I don't know if you have any other parting words or wisdom that you want to kind of pass on.
No, I think it's pretty good for today. And just wrapping it all up and starting from the top, talking about the understanding of the kind of psyche behind the runner, and then trying to get them to buy in, again, to the things that they're probably not doing. And then addressing it from a whole, as we mentioned, pretty much on every episode, every clinical episode on here. Trying to look at all the points and everything like that, and then not just treating the area of pain. But no, I think that's great. I'm sure we can lead off into some other more in-depth conversations about either treatment or whatever it may be, or to go into the sprinter athlete. But I think that's pretty good for today.
All right. Awesome, man. Quick announcements. We have, big slate of courses coming up this fall. Cervical thoracic management in Verona at Pursue PT in September. lumbo-pelvic management at Jeremy's place in Glassboro at Trifecta. We have a quick, fun one-day extremity course, upper and lower extremity course in November, and then our heavy hitter, the popular one, spinal manipulation, in December. So, please check those out. Any questions, please feel free to email me or Jeremy. We also have our mentorship program, which is awesome. We got 3 fellows, myself, Jeremy, and Kyle Feldman, all from different schools or different fellowship programs, but we have a similar mindset. But we also have different ways of looking at things, and we all have our strengths in different areas as well. So it's a great way to advance your knowledge, your career, your clinical practice, and even business side of things as well. So if you're interested in that or want more information, again, please feel free to reach out to me or Jeremy. All this information can be found on our IOSMT website, so please go there. And hopefully we'll see you in one of our courses or on one of our virtual round calls.
Awesome. Well, thanks for listening in, everyone. Great episode, and hopefully we can get our runners back running out there. And yep, cheers, everybody.
Cheers, guys.